I'm Doc Emy Cua, and this is MugshotsNow, a modern digital Filipino media platform. Watch life from a new perspective, bringing a new flavor of fun, a new revolution of entertainment, giving you our best shot now. Ask the expert. Health is a state of body, and wellness is a state of being by Jay Stanford. Mga ka-mugshots, welcome to Mugpahaba ng Buhay every Tuesday at 6 p.m. Please follow us on Instagram, Facebook, Twitter, and YouTube. Ang episode natin today ay Ayokong mag-positive sa COVID-19. These are about kailan ba magpapatest sa COVID-19 at ano ang mga home remedies that we can do kapag meron tayong COVID-19. So ang makakasama natin today ay isang graduate ng Masters of Public Health from Icahn School of Medicine in Mount Sinai, New York, and meron din siyang Masters of Science in Healthcare Management from the same university, and graduate siya ng Southeast Asia Leadership Program from Harvard University. Siya ngayon ay isang manager of the Southeast Asia Operations Division of one of the biggest healthcare group in Singapore. So mga ka-mugshots, I'm very, very excited to welcome Dr. Elise Nicole Catalan. Hi, Doc Nikki.
Hi, Ems. It's so nice to be invited to this, and congratulations on having this great platform to educate and help a lot of people.
Okay. Hi, Doc Nikki. Say hi naman sa ating mga ka-mugshots na nanonood ngayon.
Hi, everyone. Good evening from wherever you're watching this. I hope that you'll find our discussion helpful.
Okay, so hindi na tayo magpapaligoy-ligoy pa, Doc Nikki. So, ito ang ating mga katanungan, no? So, ngayon, syempre, sa pandemic natin na COVID-19, alam natin to kasi more than 1 year na tayo nasa pandemic na to. So, paano nga ba tayo makakahawaan ng COVID-19? Kasi 'di ba parang like ako, more than a year na never naman ako nahawaan ng COVID-19. So, ano ba yung activities o saan ba tayo nagpupunta kaya parang mas prone tayo mahawaan ng COVID-19?
So usually, this has been, you're right, this has been going on for about, a year, and we've been hearing so many things about it. But I want to be very technical about, where we get COVID, and these things I'm sharing is from WHO and NCDC. So basically, my 3 ways to basically get COVID. So it's either breathing in air when in close contact with an infected person through those small droplets and particles that have the virus. That's either also having, these small particles that contain the virus land in our mouths, eyes, nose, especially through splashes, my sprays, like cough or sneeze. And then also if you touch these things through your eyes, mouth, and nose with your hands that have virus on them. So in general, that's where you basically get the virus. And one important thing about it is you usually get it from very enclosed spaces, and those places that are not well ventilated. That's basically it. And also this length of time you're exposed to the person who's potentially with COVID, that also affects it.
I see. So, syempre ngayon, it's really super hot kasi summer. So, syempre, a lot of people, kahit may COVID, gustong mag-malling. So, safe ba yon na mag-malling tayo ngayong COVID?
True. So, I'd say it's...
Or mag-swimming. Di ba? Mag-swimming kasi talagang mainit. Safe ba yon, Doc Nikki?
So yung beach and yung swimming, there's no proven cases that say you can get COVID from doing those activities. But if you're exposed with someone with COVID, and especially within 6 feet from this person, and cumulative more than 15 minutes na exposed ka, you're more at risk of getting COVID.
How about in the mall? Kunwari, I'm far naman from other people. Is it higher risk na I get COVID dahil magmumalling ako?
I mean, I would advise personally what I tell my own family. If it's advisable na you don't go out, or if you don't need anything na very important or any errand na di important, it's advisable really not to go to very high traffic spaces. na potentially enclosed, potentially very poor ventilation also, especially the vulnerable population, whether you're very young or you're very old or you have an autoimmune disease or things like that. Yung mga special na populations, those sila dapat talaga that don't go. Pregnant women also are a lot more high risk in going to these places. So if you were to go out, I would highly suggest that, somewhere na open air, no, well ventilated, na you don't have to stay for so long. Mm.
Yeah, so syempre you stay at home all the time. Syempre you miss going out and getting good food. So syempre yung alternative ng mga tao ngayon is magpa-food delivery na lang. But I've been seeing a lot of Grab riders and Lala Move riders talagang minsan hindi sila nagmamas, magkakasama sila, kumpol-kumpol. So syempre, I was wondering, can I get COVID ba from my food deliveries? Or can I get COVID from food? Kung kunwari yung nag-prepare ng food sa wherever ako nag-order, can I get COVID from that?
So the food itself, there are no known studies or report that you can get COVID directly from food itself. It's not spread that way. But as you've mentioned, if you have prolonged exposure to this Grab Lala Move driver na unmasked, and you're also unmasked, and cumulatively ang tagal ng nag face to face kayo, or he or she sneezed in front of you, that would put you at risk. But basically, if it's a simple delivery na both masked, na di naman prolonged exposure, it's not very high risk.
Yeah, so for example naman, kasi ngayon parang I get a lot of questions din kasi syempre 'di ba parang pareho lang sa common cold or ubo-sipon yung COVID-19. So paano mo malalaman na normal ubot-sipon lang ba to o COVID-19 na ba to?
So the tricky part about COVID, kasi COVID and the flu, they're both primarily like respiratory virus, right? And they initially present very similarly, and then tas parang you get tired, tas yung runny nose. But as I was going through, the CDC, what they're saying about it is, although wide range yung two, they're very similar. The fraction of severe diseases appears to be very different. So, yung parang mild lang to asymptomatic, they're about 80%, and then 15% mga severe infection. So, the fraction of severe and critical infection from COVID and infectious disease ang different nila. So, it progresses differently. And also, the COVID happens to be longer yung time niya na parang incubation, whereas influenza is said to be about 3 days. So COVID on CDC about 5 days yung katagal ng interval. So it's really difficult to differentiate at first. But sharing from where I am in Singapore, any symptoms na upper respiratory tract infection, they will immediately assume it as COVID unless proven otherwise. So in most countries, that's how they treat it.
I see. So, for example, Doc Emy, I have one of the symptoms. I want to get tested for COVID-19. Ano ba yung mga tests that we can do, and meron ba yung pwede kong gawin dito sa bahay kasi I don't want to go out anymore to get exposed pa?
Got it. So, there's basically 3 categories of testing. So if I would want to simplify them, yung first is to identify whether the actual COVID virus genetic material exists. So ito yung NAT, yung NAT, which is basically your PCR test. Na it's testing via your nasal or nasopharyngeal swab, and then they look at the genetic material itself. This is basically the gold standard worldwide. Yung second type of test is to identify one of the outer proteins, the viral shell, if nadidetect ba siya dun. And this is the antigen testing. So the antigen testing is usually the rapid test, diba? That whether they detect if you have it or not. As you mentioned, there's some at-home kits. However, the caveat here, it's not always very sensitive. And then also the third type of test is to detect whether there's antibodies in the human body. So this is your IgG, IgM test. It's whether to check if you have like current active infection or if you've had previous infection.
Okay, so Doc Nikki, ano yung advantage of each of the testing over the others? Ano yung advantage of getting this test or that test? 'Di ba? Parang 'di ba each test iba-iba siya.
Yep. So yung PCR test is mentioned, they're checking the genetic material itself. It's the gold standard worldwide, and it's the most sensitive as well. And those actually, it has to be done in like more sophisticated laboratory settings with special instruments. So that actually takes a bit longer time. But once you have that result, you're definitely sure na yung whether you're really positive. Antigen test, as mentioned earlier, it might not be as sensitive, and then also, it depends also on the timing of when you did it. And then yung antibody testing, it's usually done not as a primary diagnostic tool, but more of pang adjunctive na what they test alongside your PCR testing. So I can share with you here. So some countries, when they like China, for example, when they admit someone in, combo yan. They order for RT-PCR alongside yung antibody testing, the blood tests.
I see. So, when ba should I get tested? Kunwari, kailan ba contagious ang COVID-19? So, I got exposed to a person with COVID-19. Do I have to get tested ba today, tomorrow? Kailan ba? So, we'll leave that question hanging and we'll answer that when we come back. We're back and welcome back to Magpahaba ng Buhay with me, Doc Emy. So tonight we have our guest with us, Dr. Elise Nicole Catalan, a public health specialist based in Singapore. So babalikan natin ang question na hindi natin nasagot kanina before the break. So our question is, when is COVID-19 contagious? So I got exposed to a person with COVID-19. Do I have to get tested ba? And when do I have to get tested? Doc Nikki?
Sure. So they're saying that, people are thought to be most contagious early in the course of their illness. So when they're beginning to experience symptoms, especially when they're coughing and sneezing. So, but sometimes also, people with no symptoms can also spread COVID to other people, which is a bit more dangerous. So with regards to the timing, yung PCR test is very sensitive at point of, yung first week to second week of your infection. So it will for sure pick up on the test, but after the third week, it's not as sensitive anymore. It might not be able to pick up, the COVID positive tests. And as well as the other kinds of tests, like your antibody testing, they're more sensitive as different points of your the COVID illness. But back to your question, Ems, when exactly? They're usually saying the day 5 usually is what they sort of suggest once you check. But also that day is also quite difficult to to sort of predict and be very sure about it. So, what I can share with what other countries are doing, once you're contact traced and they know you have very close contact meaning you're within 6 feet of this person, you spent a cumulative more than 15 minutes with this person, they usually do a swab test on the day itself that they're found out to be a close contact. So that's what's usually done, at least in the Singapore context.
I see. So, kunwari, I was around with this person with COVID-19, then my test came out na negative. Do I still need to quarantine ba for 14 days?
Yes, for good measure. So the reason being, it might not be detected at that point yet. So this is a very tricky thing with COVID testing, because you might think that you're negative, but actually in a couple of days you might turn positive, and that's when it gets picked up by the testing. So by good measure, you're supposed to quarantine within 10 day 10 to 14 days. CDC would say after the 10th day, you're no longer infectious and you can go out. Some people say also 14th day. So just to be very also precise about it, what CDC is saying after the 10th day, that the symptoms begin, most people will no longer be contagious as long as their symptoms have continued to improve and their fever has resolved. So that's what they're saying. And then one also important thing to highlight that I think people sort of they switch the term around a lot between isolation and quarantine. So quarantine actually keeps someone who might have been exposed to virus away from other people, whereas isolation is keeping someone who is infected with the virus away from others, even in their own home. So those are quite interchangeable terms that sort of people quite get confused about.
Okay. So ngayon, some LGUs here give ivermectin for free. And, there are a lot of controversies with the use of ivermectin. So, ano ba talaga ang totoo? Does ivermectin really prevent COVID?
So it's a very interesting topic because it's very hot on social media. And even with my own parents, I argue with them on this because there's not enough scientific evidence elsewhere, and people who are very convincing, and they say this is the right thing to do, and we're giving it out for free, and these people have so much power, then people tend to believe that it's correct. So anyway, FDA is all over the world, like the US FDA, and I believe the Philippine FDA also have all said that it's not effective. So they're saying that it's not effective in treating and preventing COVID-19 in humans. And then, just so people know what ivermectin is, it's a very specific doses. They're used to cure some parasitic worms and some like head lice and skin conditions like rosacea. Yun talaga yung use ng ivermectin. Also, what people should be very careful about, and in some levels of ivermectin, they can interact with blood thinners. So if you're taking blood thinners already, and you can also overdose in ivermectin, which can cause nausea, vomiting, diarrhea, hypotension, yung low blood pressure, any allergic reactions, yung seizures, coma, and even death. So it's not a trivial thing when you give unproven and untested medicines to the public.
How about yung ano naman, yung mas nauna sa ivermectin, hydrochloroquine? So can it cure ba COVID? Or kunyari, na-expose ako, sa kapraningan ko, can I take it in advance para hindi ako magka-COVID?
So that one also is very controversial. But this one, although yung hydrochloroquine, came from one president, diba, at some point, and then, just so people know, it's typically used to treat malaria, lupus, rheumatoid arthritis, and there have been some studies that are saying that possible treatment for COVID-19. However, current data shows that this drug does not reduce deaths among hospitalized COVID-19 patients, nor help people with moderate disease. So there's still more decisive research that has to go into this that can say that it's really helpful in the treatment of, but definitely hydrochloroquine should not be used to prevent COVID, or you should take it in advance, or para protective, wala, it has no value at all.
And ngayon, syempre, super sikat sa mga Filipino-Chinese community. Talaga, even some other people are really convincing me to take the Lianhua Chinese medicine. So, can this cure COVID ba?
So if I'm not mistaken, our sort of FDA gave emergency some version of it, but anyway, the traditional Chinese medicine, yung TCM, I know they've been prescribing this, but only for symptomatic treatment. However, I would still caution that this is not a proven cure for COVID, so it's not really prescribed by most or all medical doctors. They wouldn't advise people to take this.
Okay, so how about the tuob or suob? Can it cure COVID? Diba, it had been all over social media after a politician recommended this.
True. So this one was exactly a year ago when this blew up in our province. People who don't know, I'm from Cebu, and one of the politicians there was strongly advocating for it as a cure, although retracting it later on. But then, I know culturally, like in the olden times, like traditional medicine, they've been using tuob or suob to relieve upper respiratory symptoms. It makes them breathe a little better, and it sort of gives some form of relief. This definitely is not a cure. It can be looked at as something that can help you maybe relieve some symptoms, but it's definitely not the cure, because the misconception there was that the heat from the steam would kill the virus, which is totally wrong, and is not. The heat totally cannot deactivate or kill the COVID virus itself. So that's one very important thing to note. Also, I was crusading very heavily against it because people were doing tuob thinking that this will either prevent and cure the COVID itself, which would delay health-seeking behavior. So if you delay health-seeking behaviors, you actually not see. You think, oh, I'm being treated, I'm doing something, I will not see the doctor. And then by then, when you're really feeling bad, you cannot breathe anymore, that's when you seek medical care, and it's sometimes very late. Which has resulted to some deaths already related to this. So that's why I'm heavily against this to being a cure or that really big.
Yeah. So Doc Nikki, what will be our take-home message of what can they do at home if they have COVID-19?
I think the most prudent thing to do, number one, is to inform your close contacts. I think this is not emphasized enough, because there's a stigma around having COVID. I think in the Philippines specifically, if you have COVID, people tend to hide it. People tend to not tell their close contacts about it because they're ashamed that they have it, and there's so much stigma. So the first thing really is to inform your close contacts, to monitor their symptoms, and if need be, if they're symptomatic, need be also have themselves tested. So anyway, when you're at home, what's really needed is you monitor your symptoms. If they either get worse, I know a lot of people have bought all these pulse oximeters, which is very helpful to monitor their oxygen saturation. Also, a lot of these, like there's literature on this already, that 80% are really just mild presentation of COVID, where they can just rest it out, have better nutrition, better hydration, and just sort of isolate themselves until they get better. So nothing. There's really nothing special you can do. Sometimes for the mild and asymptomatic ones, they sort of self-resolve on their own, but with great caution that they don't spread it to other people.
Okay, I'm sure maraming natutunan ng ating netizens with our episode today, and they have a lot of questions. So we'll after the break, we'll read all their questions and we'll answer all their questions. So please don't go away. We'll be right back.
Special thanks to Nagit Escorel Dental Clinic, Dermacare, Face Body Laser Center, Andy Passion Eyebrow Embroidery.
Hello, mga ka-mugshots! This is Doc Emy. Please don't forget to watch our other programs. Magnegosyo with Maida Sandig of Digital Innov every Monday at 8 p.m. Magluto with Charles Gerardo every Tuesday at 11 a.m. Magpahaba ng Buhay with me, Doc Emy, every Tuesday at 6 p.m. Magtanong with Attorney Maggie every Wednesday at 11 a.m. Mag-G with Yuka every Wednesday at 3 p.m. Magbuhay Celebrity Lawyer with Attorney Maggie every Thursday at 7 p.m. Magpatinta with Manu and Bob every Thursday at 9 p.m. Magmahal with Yuka every Friday at 9 p.m. Mag-Gig with Owen Fermento every Saturday at 8 p.m. And Mag-Wine Tayo with Attorney Maggie and Charles Saturdays at 9 p.m. Hi mga ka-mugshots! We're back here at our episode of Ayokong Mag-Positive and Magpahaba ng Buhay with me. So our guest for today is Dr. Elise Nicole Catalan, and now sasagutin na natin ang mga questions ng ating netizens. So first, we have a question from Joy from Albay. Kailangan ko ba maglinis ng bahay para ma-prevent ang COVID at nakakatulong ba ang pagbilat ng mga gamit sa araw para mamatay ang COVID?
So, what we know so far, yung cleaning, what's advised is yung high-touch areas sa bahay. So, high-touch areas being yung doorknobs, tables, handles, light switches, counters, yun are advised for cleaning. Especially using yung mga chlorine or bleach based na cleaners, that is proven to be effective. So it's good to have your home clean. So that's the general recommendation.
Pero yung pagbilad, can I
I mean, there's no
bring
harm.
out my things at ibilad?
Oo.
Does it really kill
So
COVID?
there's no harm in doing it. There's no actual literature behind saying how long dapat ibilad or if it definitely kills. But so far, I'd say nothing wrong in doing that.
Okay, so our next question is from Jonathan from Batangas. Pwede ba mahawa ng COVID galing sa mga lamok at ibang pets sa bahay tulad ng aso at pusa?
Okay, so good question. Yung COVID doesn't spread that way. It doesn't. COVID is not spread through mosquitoes or pets. So you couldn't get COVID from those two.
Okay, next question is from Eric from Parañaque. Effective ba ang UVC lamp?
Okay, so
Nauso kasi to for a time.
Yeah, that's very true. So yung UVC lamp does help, especially kung it's a legitimate UVC lamp. So it's known in the healthcare setting from long time ago. It's a long practice na they do clean surfaces, equipment, so operating rooms, mga PPE and masks. It does clean and it does help kill the virus. But what's important to note, only use it for objects, never on your hands. And there's also a warning whereby if you're exposed to the UVC light, and it could actually cause burns sa eyes. So you shouldn't do it you shouldn't stare at it or this UVC light, or use it on your hands itself or any part of your body. Mm-mm.
Okay, yung next question natin is from Gary of Manila. Lahat ba ng mask effective para hindi mahawa ng COVID? So, di ba ang daming mask? May tela, merong surgical mask now, may N95. So, lahat ba yun effective?
True. So mask wearing is proven to help the prevent the spread of COVID. But what's important is some masks are actually not helpful. So especially masks with yung may valves on the side, it does protect you, but it doesn't protect the other person. Let's say you have it, you're actually just spreading it out also. So those kinds of masks in several countries are actually not advised for use. And also with mask wearing, right? What's important, what's most important is wearing it properly. So a lot of people wear it, but then it's here on my nose, or even I have this thing with people taking pictures, and they take off the mask, and then parang, oh, mask taken during picture, and then immediately placed after. Actually, it's quite funny to me because it's not like the virus would stop for the picture also. So if you take it out, you're also exposing yourself and others, and if there's someone positive there, then it's proving some risk. Yeah. Mm-mm.
Okay, then we have a question from Teresa from Italy. So, effective ba ang air tamer? Ako actually, I got this as a gift also nung Christmas, air tamer.
Right. So even like a lot of people, myself included, was gifted it. My parents have it. A lot of people actually were panic buying like early, at some point last year. So the thing about it, there's nothing wrong if you want to wear it and you feel a bit more, protected. But really, it's not 100% proven to kill COVID or to suck the air in. It's not 100% proven. And also, what people don't know is there's some radiation exposure from these little things that you wear. So there's still budding literature on it. It's not very well established yet, but they have warned that there's some radiation exposure associated with this wearable air purifiers. And then there's some also, I know some opportunistic people na they sell fake ones or ones that really don't work. So I think it's good to know what ones are legitimate and what might be fake ones that really don't have any use.
Okay, so thank you very much, Doc Nikki, and thank you for your time. And I'm sure nabitin yung netizens. So sana next time, if magka-episode ulit tayo about this, we can invite you. So do you have any last words po for our netizens?
Sure. So thank you, Ans, again for giving me this platform to share. And I really think this is an amazing thing you're doing for the greater public. There's so much misinformation going around. And really, it's the responsibility of people in the medical community and those who know to actually spread and spread right information and to do some myth busters on really the wrong things. So this pandemic, you only read about it that happened, histories, centuries ago, and it's quite amazing to me that we're experiencing it now. Amazing in a bad way, but it's good to know that it's really a we disease, not a me disease, because it doesn't affect just you. It's a communicable disease; it can spread. So it's really a group effort. It's a worldwide effort to tame and control this virus. And also, I keep saying that people have to be careful, not fearful. We're not out to scare people, but it's really we just have to be careful because we care for ourselves and our loved ones, and we have to look after each other. So I think that's one great takeaway from what's happening now.
Okay, thank you very much, Doc Nikki, for your time tonight.
Thank you, Anne.
Okay, so thank you so much, mga netizens, for joining us tonight. I hope you really learned a lot kasi I really learned a lot even sa mga ibang things na pinagbibili natin last year, kung ano ba talaga ang katotohanan dito. So, thank you so much for joining us tonight. So, as the expert, Health is a State of Body and Wellness is a State of Being by Jay Stanford. Thank you mga ka-Mugshots, and see you every Tuesday at 6 p.m. Ako si Doc Emy Cua, and dito lang sa Mugshots Now, Magpahaba ng Buhay. So follow and subscribe on Facebook, Twitter, Instagram, and YouTube. Keep safe and God bless everyone.
Special thanks to Nagit Escorel Dental Clinic, Dermacare, Face Body Laser Center. Anipasyon Eyebrow Embroidery.